assessing a patient who's a 35-year-old female. She's called the ambulance for a bleeding nose. She was playing rugby when she was hit in the face with a rugby ball. As instructed, has been holding her nose sitting forward, holding the fleshy part for the last 15 minutes. It is still bleeding when we get there. Her primary and secondary survey is clear with no abnormalities. She's not lost any consciousness, has no medical history, not on any medication. She has a GCS of 15, and yeah, we're just about to come in and introduce ourselves. So hi, my name's Julia, I'm from St John Ambulance.
Hi Julia.
Can you tell me what's happened today?
I was just playing rugby and I hit my nose on someone else.
Oh, that's no good. Okay, I'm just going to get my partner to take some vitals and they come back all normal, so that's actually quite good. All your vitals are normal. We're just going to get this bleeding fixed since you've already done this for 15 minutes. Okay, so I'm just going to draw up some adrenaline. So I'm drawing up 1 in 10,000 adrenaline by diluting 1 milligram of adrenaline to make up 10 mils. With the saline, I'm going to give you 2 mils into the bleeding nostril. I see it's just coming out of your right nose there, so we're just going to give you 2 mils into that one size. We'll use it with this mucosal device here. Okay, so while I'm doing this, I want you to just slowly blow your nose to clear any clots. So not too hard, okay? Okay, so my partner's done all the drug check on my vial of adrenaline here. And I'll check that it's not expired, and it's adrenaline 1 mg and 1 ml. Okay, so I'm just going to get this ready for you. Are you alright there? Got a sharp spin, just put that in the sharp spin over there. Okay. So I've already got 9 mils of saline here, and I want to put in 1 mg. We're just going to pop that down for a minute. These are a bit tricky sometimes. Okay, so I'm just going to draw that up. Okay, put that away in my sharp spin. Take this off and put that in my sharp spin. Okay, so I've got my mucosal device here. Let's make sure there's no air bubbles in there. Okay. Okay, so I'm just going to put this up your right nostril where it's bleeding. Okay, it's gone up there. Okay, so now I want you to just lean forward, and same as what you were doing before, pinch that fleshy part of your nose. Okay, so just while we're doing that, we're just going to ask a few questions. So is your vision okay? Can you see how many fingers I'm holding up here?
Yeah, 2.
Yep. Have you got any spots or anything funny by your eyes? I'm just going to get my pupil torch to have a quick look in your eyes. Okay. They're both equal and they're both reactive to light, so that's pretty good. Okay. Have you got a headache at the moment?
No.
Okay, well that's good. Have you been drinking any alcohol today?
No.
Or take any other substances?
No.
That's good. Okay. Just going to get my partner to take another set of vitals. We've been sitting here for 15 minutes. It's looking pretty good. The bleeding's stopped now.
Cool.
Okay, you feeling a lot better?
Yeah, heaps better.
Oh, good. Okay. So I'd like you to go and see your GP within the next couple of hours. Is that possible for you to do that?
That's cool.
Okay.
You can take me.
Okay. So just we just check off a few things before we leave you to make sure everything's okay.
Yeah.
Haven't got any red flags in my procedures here because there's none for epistaxis. Okay. What I'd like you to do is actually get up and walk over to there and come back and just tell me if you feel nauseous or dizzy or anything like that.
I feel good.
And the bleeding hasn't started back again?
No.
That's good, so you've mobilised. Okay, so I'm going to give you this piece of paper. It has an ACS number on it, so you can go home and print off and look at everything we've written about you. I'd like you to also take that into your doctor.
Yeah.
Okay, you can hand that over to him as well. And I'm just going to write down all the advice that I've told you about going to see the GP.
Okay.
I'm also going to hand you over this concussion sheet.
Cool, thank you.
So sees that were hit at rugby,
Yeah.
just in case you develop any of the signs of concussion. You know, feeling dizzy or nauseous or slurring your words or feeling really sleepy, anything like that, look for this sheet. You call 111 if it gets worse.
Will do.
So you're alright with that?
Yeah, happy. Thank you.
Okay. Stop. Okay, today I've been dispatched to a 16-year-old female. Chief complaint, she's complaining of a headache. She's been at school athletics today. It's been a hot day and she's been running lots of races today. I've taken her vital signs. All her vital signs are normal, except she has a slight temperature of 37 degrees. The pain, she said, has just come on slowly over the last hour, and it's throbbing all over. It doesn't radiate anywhere. She describes it as a 6 out of 10 pain. She looks hot and flushed, and she's not complaining of any nausea or vomiting. She says that she does not have a history of migraines and no family history of migraines, no history of cerebral events or intracranial bleeding in her or her family. She's had no recent falls lately, and when I examine her, I can see that she has no rashes. She's not itchy, anything like that. So she has no medical history, she's on no medications, and she's not allergic to any medicines. Today she's been eating normal food, but she hasn't been drinking much fluids, and she's been running a lot on this hot day. So I observed the patient to walk normally earlier on, and the patient has consented to this video and this assessment. Okay, first I'm going to open up some windows just to get some cool air in. I'm going to get you to take your jumper off because we want to try and cool you down a bit. Okay, we'll probably get a drink of water as well. I just need to do a few assessments on you. Is that still okay? Okay, can I get you to poke out your tongue for me, please? It's nice and moist, that's good. Okay, have you got any pain in your neck? Can you go like this? Up and down? Any spots or dizziness? Can you see how many fingers I'm holding up? 2. Okay, that's good. I'm just looking at her skin. There's no skin tinting. Her pulse is normal and regular. So that's really good. Okay. I'm just going to do what we call a fast test. So I just need to have a look in your eyes. Okay, so I'm just checking to see that they're equal and reactive. Okay, looking in both your eyes, they're both equal and reactive to light. Can you give my hands a squeeze, please? Squeeze my hands. They're both equal. Can you please smile for me? Okay, that's good. Now I want you to hold your hands up like this and put your palms up and shut your eyes. That's really great. Okay, so the fast test is clear. Okay, so you know what day it is today?
Sunday.
Sunday, you know where you live?
8 Lighthouse Street.
Okay, she has a full GCS, so that's good. Have you had any alcohol or any other substances today?
No.
Is there any chance that you could be pregnant?
No.
No? Are your periods all regular?
Yes.
Okay. Have you had any abdominal pain today or any chest pain?
No.
Okay, that's good. Okay, so you don't feel dizzy when you go like this?
No.
And is the light bothering you at all?
No.
Okay, so I'm just going to double check that there's not any rashes and things on your back. Okay, I can't see any signs of rashes. That's really good. Okay, I'm just going to palpate your spine to make sure you haven't put your neck out, and that's what's causing your headache. You just tell me if that hurts when I push down here. No pain?
No.
Okay, that's really good. Okay, so I don't think you need to go to hospital. Okay, but I would like you to go to the doctor. Can Mum drive you in?
Yes.
Mum, is that okay? Yep. Okay, that's good. So what we're going to do, just think that Charlotte needs to go in and see the doctor. If she's still not feeling very well, I think she needs to be hydrated, have lots of fluids. But just go and get it checked out anyway.
Yeah.
Doesn't hurt to have a check-up. Yeah?
Yeah.
But if you get worse, so if you start feeling nausea or vomiting, or any spots before your eyes, or you get confused, so you understand that, Mum? Yep. And you understand that?
Yep.
You call us back on 111, and I'm going to write all these instructions down on this piece of paper for you. Okay? So, got a few more checks just to do to make sure before we decide if we are going to leave you at home. And I'd like to give you a little bit of pain relief for your headache.
Yep.
So you're not allergic to any medicines?
No.
Have you had any paracetamol or anything containing paracetamol in the last 4 hours?
No.
Okay. Alright, so what about ibuprofen? Have you had any of that in the last 4 hours?
No.
Okay. So I think just we'll give you some paracetamol and ibuprofen.
Yep.
Okay, so how much do you weigh?
50 kg.
50 kgs? Okay, so you can have 1 gram of paracetamol and you can have 400 milligrams of ibuprofen. Okay, so here we go, there's some water, if you can swallow those. Takes about 20 minutes to take effect, okay? Alright, that's good. Okay, so just take another set of vitals and they will come back normal. In fact, the temperature's now come down to 36.5. What's your pain at the moment?
About a 3.
About a 3? Are you just feeling better because I'm here? Yeah? Okay, well that's good. Okay, what I want you to do is I want you to get up and walk over there and walk back. Does that make your headache worse or do you feel dizzy? No, that's good. Okay, and just before we go, I'm going to quickly run through my red flags in my book just to make sure that that's okay to leave you at home. Okay, so you haven't had any neck manipulation lately? You haven't been to the chiropractor? Your neck's not sore? So it's not a very severe headache and it's come on gradually, so it's not sudden. You haven't got a temperature greater than 37.5. You don't appear to have any flu symptoms. You haven't vomited. You know where you are and what's going on. Have you got any numbness